warriors, welcome back to my channel. And if you are a new warrior, welcome. I'm Raven and I'll be taking you all with me on my journey to conquering rheumatoid arthritis. Don't forget to like, comment, subscribe, and hit the bell button so you all be notified every time that I upload. Having rheumatoid arthritis, I am always asked, have you ever had to get fluid pulled from a joint? Fortunately, I have. So stay tuned if you want to hear my personal story with getting a joint aspiration, more information on a joint aspiration, tips to handle the procedure, and raw footage of me getting the procedure done.
She's on top of the world, hottest of the hottest girls. Say, oh, she got both feet on the ground and she's burning it down. This girl is on fire. This girl is on fire. She's walking on fire.
So sometime in 2014, my knee would swell up and it would be extremely painful to do my daily activities. With the pain, I was forced to be put on bed rest. With me being in college and it was like my junior, my senior year, that was not an option. I went to my rheumatologist and informed her on how I was feeling. So she first suggested a cortisone shot. The cortisone shot didn't help me at all. My knee began to swell even more and she realized I had large amounts of fluid built up. She informed me that she had to drain fluid from my knee. I was scared. Hearing all the stories from relatives and friends about the procedure, I just knew I was about to turn into a child in the doctor's office. Now, if you know me, I hate pain. I am a wimp. The procedure did not hurt at all. She took about 3 syringes worth of fluid out. Later that day, I relaxed because I wasn't sure what to expect from having my first knee aspiration done. So the fluid just kept coming back over and over, maybe every couple of days. So it became ongoing where I had to go to the office maybe 3 days a week. So the lab results continued to come back fine, but showed a lot of inflammation, which we already knew. Even though this procedure lasted for months, I don't regret it because it still helped me for a few days at a time. Okay, so now fast forward it to 2019 where I had to receive another knee aspiration. Because I had fluid drained from my knee over 50 times, and I'm not exaggerating, I knew the process was a breeze. So the person who was removing my fluid was my PA, which was my surgeon physician assistant. As she begins to pour the fluid, I screamed so loud that probably every person in the building heard me. I said every bad word you could think of. That was the worst pain of my life, worse than the knee replacement. So immediately I thought the intense pain that everybody was telling me about in 2014, this must be it. I was confused because I've had the procedure done a million times and I couldn't wrap my head around why it was so painful. The PA kept apologizing, and while she was apologizing, I'm gathering my belongings ready to leave. I was done. The PA kept begging me to stay and informing me how important it was to get the fluid away from my knee. So I gave in. I screamed again and I was crying non-stop. This time I'm like, I'm leaving, forget this fluid. I don't care, it can stay. I just wanted to go home. So the PA once again kept begging me to stay and was telling me I can't leave with all this fluid surrounding my knee. She wouldn't allow it. So I've been seeing her for maybe 3.5 years. So we have a good relationship. She told me to stay and trust her and she'll be back. Because she never led me wrong in the past, I was like, okay. But I told her she's not allowed to touch my knee again. She came back with another PA. So I let this PA touch my knee and a couple of seconds later, she was done. I didn't feel any pain whatsoever. No screaming, no crying, no cursing, nothing. I was relieved. So we found out why the first 2 attempts were painful. My PA was not taught to numb the patient's site twice. Once with an injection in the knee and the second time with a cold spray called ethyl chloride. The second PA was taught to numb the patient twice. So we realized I was used to being numbed twice. So a joint aspiration is the fluid drainage, which is fluid being poured from the knee. And of course you can get fluid poured from the hip, ankle, shoulder, elbow, or wrist. but in this video, we will focus on the joint aspiration in the knee, which is the most common as well. So a joint aspiration is a procedure where the doctor will use a sterile needle and syringe to drain fluid from a patient's joint. Joint aspiration can be both used for diagnosis and medical treatment of arthritis of a joint. Joint aspiration is used to get fluid from the patient's joint for examination in the lab. Analysis of joint fluid can help the physician to define causes of swelling, arthritis such as infections, gout arthritis, and rheumatoid disease. Fluid from the joint can be tested for white cell count, crystals, protein, glucose, as well as culture to detect infection. Joint aspiration can also be a helpful treatment in relieving joint swelling and pain. So the process, there is no preparation needed before the procedure. You will sit on a table at the doctor's office. The doctor will move the fluid around so it'll be in one place or try to get as much of it in one place. Next, the doctor will clean the skin over the joint. Then you might get a shot or a spray of a pain-numbing drug at the place of the injection. Your doctor will insert the needle into your joint and draw a small amount of fluid out into the syringe. After the fluid has been extracted, your doctor will inform you on how to care for the site. There is no recovery time required after joint aspirations. Doctors typically will suggest avoiding stressful activity with the joint for at least 24 hours. Now we will discuss my tips on receiving a joint aspiration. Usually I always share 5 or 6 tips in my video, but this time I have 2 tips. So tip number 2 is to breathe. Relax, you'll be fine. Depending on how much fluid needs to be poured out, the procedure should be 5 minutes or less. Tip number 1, make sure the doctor, the PA, the surgeon, whoever is performing the procedure, numb you twice. Once with the injection and once with the cold spray. Do not let them drain fluid if they did not numb you twice. I don't care what they tell you, let them numb you twice. Thank you for listening to my story, information on a joint aspiration, and tips to handle the procedure. Now stay tuned to see footage of me getting fluid drained from my knee.